From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about fall prevention, especially for the aging population. Our guest today is a nurse and the Trauma Injury Prevention Coordinator at Sarasota Memorial, Casey Howell. Casey, thank you so much for joining us.
Hi, thanks for having me.
Your title, Trauma Injury Prevention Coordinator. When most of us think of trauma, we think of terrible accidents, the worst.
Sure.
Maybe car accidents, other horrific injuries, whatever it might be. Are falls actually a cause of trauma?
Absolutely. So when we use the word trauma, there's a couple different kind of connotations associated with it. A lot of times we're talking about psychological trauma, which would be the emotional response to a terrible event. All right, but physical trauma is essentially just a serious injury to the body. And serious is, it varies a little bit, but if I have broken the skin, if I have interrupted structures, if I have damaged, bruised something, if I have open bleeding, then that even at a localized area has been a traumatic injury to that area of the body.
Why are falls such a concern to the aging population?
So falls are our number one mechanism of injury, especially in our community specifically, and really in the aging population in general. So 1 in 4 older adults fall every year in the US. We have nearly 3 million patients that are treated through ERs, a lot of them requiring admission and extended hospitalization as a result of falls, and approximately 40,000 deaths every year in the US related to a complication from a fall. So it's a huge problem.
So what are some of the most common traumas to occur from falls, or those biggest complications which can even result in death?
Sure. So one of the most common injuries that we see from falls are broken bones. Hips, wrists, upper arm, things like that, especially when you go to brace yourself for a fall. And head injuries are also very common. And so the hip fractures and head injuries are some of the most serious injuries that can result in serious injury, debility, and death.
And we discussed it in a previous episode of this podcast, but for many in the aging population who might be on blood thinners, that's especially of a concern.
Then their risk goes up dramatically.
What kind of assessments might be done to determine a person's fall risk?
Sure. So there's a lot of different types of screening and assessments that are done, whereas a screening might be a little more superficial, might be a questionnaire to a doctor's office, might be, just kind of a more cursory type of evaluation to identify those who are going to require kind of a more in-depth, personalized risk assessment. And then fall risk assessments also vary in their technique and who's performing them. There are digital fall risk assessments, the physical evaluation of gait, often performed by physical therapists or physical therapy assistants. And then there'll be physical assessments also performed like at your doctor's office and routine health screening. So they vary in how they look and what their ultimate kind of goal is, but all screening and risk assessment is really about awareness, right? Increasing an individual's awareness of their own particular risks and what that's going to look like for them in their life to help try to mitigate that fall factor.
We all know those family members or friends who are very stubborn. So if someone is concerned about their own fall risk, if they're not stubborn, or if someone is concerned about a family member or friend who maybe isn't willing to admit that they might have a fall risk, who should they speak with first?
So anyone, really. But ideally, just like most things, going through your primary care provider, speaking your concerns with them, and then being referred out to different specialty services as needed. If it's going to be a while or you just had a physical and you didn't, at any point, any step of the way that you're interacting with medical health professionals, speaking and voicing concerns about fall risks should at the very least get you some resources or recommendations to the next person or the next step in the line there. Or you can attend community events with fall risk screenings and fall risk education that will often have resources to refer you to as well. But touching base with your primary care is always a good jumping off place for most things.
And SMH you do those fall risk assessments at SMH. Can you talk a little bit about that?
Sure. We do a digital fall risk assessment with what we call a B-track system. So it's a digital platform that will measure the pathway from center, how much you have to essentially make small body movements in order to stay upright and not fall during little timed short intervals that will average together and take that into consideration with your age and gender, and then put you into a low, moderate, or high risk category. So we do that once a month at the Sarasota campus and the Venice campus, each through the Health Connection. So that's a really great opportunity to come and we do an educational presentation in the beginning to give you some tips and tricks about things you can do in your environment and personally managing your medical conditions or things that might factor in, and then give you your actual individualized digital risk assessment and resources to follow up and what to do with that information.
And as an aside, to those who might be listening to this podcast or watching it, if you're interested in those fall risk assessments, you can visit smh.com. The events page has the calendar, which lists where those are and when, whether it's at the Sarasota campus or Venice, and when, and how you can get involved. So if someone is determined to have a fall risk, what do you advise them to do in order to reduce the risk of falls at home?
Sure. So there's essentially, when we look at this, there's two major kind of categories of risk factors that I'm looking at: the things that are in your environment and the things that are interpersonal and specific to you. So environment, I often feel like sometimes is the easiest one to address first. So curbs and steps are the number one contributing factor to injuries related from falls. So that even parking blocks, curbs stepping up onto the sidewalk, steps to get into a building or steps inside your home. So being very aware, having that kind of heightened situational awareness when out and about in public, especially knowing those curbs and steps. A lot of times what happens is that we don't lift our toe up quite high enough to clear the curb or step, and we catch the front part of our toe, and that facilitates a fall. And then if you have steps in your home, making sure that they are clear of clutter and debris, any extra additional things on there will significantly come into play. Making sure there's handrails and appropriate things to stabilize and grab onto, assistive devices, things like that. Additionally, in the home, we want to try to reduce excess clutter, furniture, things that might block our hallways, which I don't know if you're anything like me, though. Even after just a year or so, I look around my home and it's like, where did all of these things come from? We seem to just accumulate these kind of things, and we don't notice as much when it's one thing at a time here and there. And then over time, there's a significant amount of clutter. So particularly if you are an individual or you have someone who lives with you or visits regularly who uses an assistive device like a wheelchair, a walker, a cane, they need especially a wide breadth and reduced clutter, and furniture, bulky pieces of unnecessary furniture can really become a tripping hazard. Lighting up your environment is a big part of it too. So one of our riskiest times is in the middle of the night to go pee, right? When we intentionally want a nice dark space to get good sleep. So that can become a factor that will contribute to falls. So night lights, especially the motion activated ones, are really nice. So they don't have to be on and bright all the time, but should you get up and that pathway you're taking from the bed to the bathroom or into the kitchen maybe to get a glass of water, something like that, having some sort of assistive lighting to help also helps with pets, especially smaller pets that are nice and quick, right? And we can't see them as well or react as quickly as they can to us. Those motion activated lights will pick up when they pass by them as well and can help alert you to the fact that there's an additional tripping hazard potentially in your way. So really any Mats, rugs and mats, those are also a huge contributing factor. So loose, unsecured rugs and mats is a big problem. So we want to secure rugs and mats all the way around, not just the corners, but the edges as well. So using like a double-sided rug tape can be particularly helpful. Any unnecessary rugs and mats or ones that are in locations that are more prone to contribute to tripping or falling, we should consider removing those, but making sure that we do have them in slippery areas, like right out of the shower or tub. Very important to have a nice like absorbent mat there to prevent slipping, usually on those tile or slick surfaces. But again, it's really important that it's secured appropriately to the ground. So sometimes the bath mat like that hotels love to put out, which is really just a towel like with a design in it, there's nothing to secure that. So those can be particularly dangerous in a moment of vulnerability and slippery surfaces and a slippery body. So using something that has a nice, good securing element to it is really going to be helpful, and making sure that you're wearing appropriate footwear for you that fits appropriately. It's not going to contribute something that has ideally a rubber sole and some sort of traction or grip on it. The higher the heel or wedge, the less stable that becomes. So take into consideration where you intend to go in those shoes and if that's going to be appropriate again for the environment. And then we look at the interpersonal things. So balance is one of our greatest predictors of your potential risk for fall. So your ability to balance is paramount, especially kind of as we age. And it's the core muscles that we use that contribute most to our ability to balance effectively. So there are lots of exercises that we can do, even chair exercises that are low impact and can be done from home, 10, 15 minutes a day. Simple things that we can do to help improve our core strength, and that will help improve our balance and thereby reduce our fall risk essentially. So that's something that we teach as well in that fall risk assessment education that I do at each campus every month. So that's something we go through as well and make sure that we give those exercises and descriptions of those, how to do those at home. And then looking at things like Parkinson's, if you suffer from vertigo, severe osteoporosis, osteopenia, if you've had a stroke in the past and have a weakness on one side of the body as a result, all of those things are going to significantly contribute to your personal risk factors for falls. Also medications. So a lot of cardiac medications can result in different ability to adjust especially when we're lying or sitting and standing and change position. That's called orthostatic hypotension. You get that. If you ever stand up too fast and you get that kind of right?
Of course.
So that's orthostasis, and that can happen naturally. And then a lot of times there are certain cardiac medications, blood pressure medications that might make that a little bit worse, and that's a high risk moment for those individuals. So that's definitely something that you might very well need that medication for very good reason. But that means that we need to identify that as a potential risk for that person and make sure that they're aware that they need to build extra time into their transitions, that they need to anticipate that sensation, that happening, and make adjustments and accommodations for it to keep that fall risk low.
Does it ever happen that if someone is determined to have a fall risk, they are referred to maybe physical therapy outpatient?
All the time. In fact, even those people that we do the risk assessment and they screen to be low risk, there are still things that I want them to do to maintain the low risk. So those exercises, seeking out matter of balance courses are one of the #1 evidence-based practice programs that we can use to help reduce fall risk even greater and to keep it low for those that are already in the low category. But yeah, physical therapy, outpatient programs, exercises, all of that are going to be very helpful.
And you talked about things you can do in your home or in a close family member or friend's home that you visit quite frequently to help with fall risk. Is there anything you recommend for people to look for when they're going out and about?
Sure.
Because even if you have a fall risk, you're not homebound.
You're homebound. You still want to go out and live your life.
Yes, exactly.
Absolutely. It's going to boil down to increased situational awareness. Take some extra time to survey your surroundings, to identify the risks that are going to be in your pathway and in that environment. Give yourself extra time to make those transitions, especially, restaurants can be tricky to navigate, especially too. And slowing down and giving extra time again, to even just account for the actions of others in that environment, right? I can be very aware and responsible for my own actions, but I'm not necessarily in control of those around me. So every time I'm putting myself in that kind of public arena, especially if it's a well-populated area, then I have to additionally kind of factor in what reaction time to the actions of others that I can't control. Taking it slow, being mindful, especially those curbs and steps, taking that extra moment to cautiously approach those known identified hazards.
Is there anything else you want to add on this topic?
Oh, gosh,
So
there's
much.
so much, right? There's so much. It's really important to do a real assessment, a personal assessment too, of what are my factors? Do I have trouble hearing? Is my vision off? Do I need glasses? Do I have a harder time seeing with that? Do some of my medications make me feel dizzy? Am I getting my annual screenings for vision and hearing as well as my medical screening with my doctor? Am I using any assistive devices that have been prescribed to me appropriately and as much as I should be? Should I have something installed in my home, like grab bars in the shower are a big one, right? Do I have hand railing by steps and things like that? And making sure that you are reviewing all of your medications with your pharmacists as well, particularly if you use multiple pharmacies. So sometimes certain pharmacies might fill a medication you take for free, but the cost of the other ones that you take are more expensive there. So I have one medication filled here and other medications filled here. So recognizing that the onus of communication between both of those places is on you. Right. So I would love to tell you that everyone involved in your care communicates very actively and progressively, and there is nothing missed. But it really comes back to make sure that you're sharing your health information and all of your medications with each place that you might get medications filled. Because that one pharmacy that's filling that one medication won't be able to check for interactions for medications they don't know you take that's filled somewhere else. And that can be a huge contributing factor. So making sure that you've got an updated med list that you are sharing with all of your providers and pharmacies can really help you assess your personal medication-induced or contributing factor for falls as well.
You see how so much information. Thank you so much for joining us today.
Thanks for having me.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.